Good evening, folks. I have an extra show for you tonight. It deals with elderly people who refuse care. Okay, so we're going to go through that for families who are struggling with this. So let me enlighten people. Here we go. Let's see what the article describes. Short summary. An only child is in their early 40s, is caring for a 74-year-old mother who is declining physically and cognitively, but refuses help, medical care, and outside supports. The daughter has tried modest safety changes, grab bars, meal delivery, offering to attend appointments, but the mother shuts those efforts down and is isolating more. The caregiver fears a fall or an emergency that could have been prevented. Key problems the page highlights: medical non-compliance. The mother has chronic conditions, high blood pressure, diabetes, arthritis, and is not taking medications or getting routine care. That happens, folks, a lot. Possible cognitive decline. The caregiver reports getting lost on familiar roads, missed appointments, and trouble following conversations. And a neurologist recommended further testing that wasn't completed. Resistance to help and loss of independence. The parent insists she's just fine, rejects screenings and home help, and uses phrases like "don't start" or "I'm not an invalid." Raising safety risks. Isolation and worsening mobility increase the chance of falls, preventable emergencies. Their caregiver is worried about avoidable ER visits. How the article frames the emotional and ethical tensions. Respect versus safety. The piece centers on the hard balance between honoring an elder adult's autonomy and protecting them from harm. It shows how well intended small innovations or interventions can be rejected, and how that rejection leaves caregivers feeling powerless and exhausted. Practical next steps suggested by the context. The article itself is a case description rather than a step-by-step guide, but the surrounding content points toward these commonly used non-medical approaches. You can consider document specific concerns, keep a log of missed meds, incidents, and examples of confusion or getting lost. Concrete examples help clinicians and family members understand risk. Revisit medical follow-up. Try to rearrange a neurologist or a primary care clinician to discuss observed changes. Framing visits around a single concrete concern, e.g., I'm worried about a fall, can sometimes lower resistance. Small acceptable safety changes. Continue offering low threat options, grab bars, meal delivery, and introduce them gradually, sometimes framing them as conveniences rather than help. Reduces pushback. Leverage trusted relationships. A visit or call from someone the parent trusts, friend, clergy, neighbor, can sometimes open the door to care discussions. Getting support for yourself. Caregiver burnout is real. Look for local caregiver support groups, respite options, or counseling so you don't carry this alone. Okay, guys, now remember I said this is a twofold presentation, so we're going to get in the second half of this. The article paints a common painful caregiving scenario. A loved one who needs help but refuses it, leaving the caregiver to juggle respect for independence with mounting safety concerns. The surrounding content emphasizes small, practical attempts already tried and the emotional toll on the caregiver. Next steps usually combined careful documentation, renewed medical engagement, gentle safety measures, and support for the caregiver. All right. Family or draft a compassionate script for bringing up concerns with your parents. What the page says in short summary. The article explains why many older adults refuse help and gives a practical empathy first approach for adult children trying to respond. It emphasizes that resistance often comes from fear or losing independence, embarrassment, denial, anxiety, or cognitive changes, and that caregivers should balance respect for autonomy with safety concerns. Core reasons the page identifies for refusal: fear of losing control or becoming a burden. Seniors may reject help to preserve dignity and routine. Embarrassment or denial about limitations. Admitting need can feel like admitting decline. Okay, that does happen, folks. Let's see, next page. Cognitive or anxiety driven barriers. Memory problems or anxiety can make accepting change difficult. The 7 recommended steps. Practical approach. Listen first without lecturing. Ask open-ended questions. Speak slowly and use short, clear sentences to reduce confusion. 2. Understand their reasons. Validate feelings, for example. Acknowledge how hard it is to accept help. Start small with low pressure changes. Offer limited practical help like grocery runs or light housekeeping to build trust. Involve them in decisions and offer choices. Give options so they retain control over what help looks like. Frame help as a preserving independence. Explain how support can free time and energy. That's more practical, guys. That's the easy way to ease them into accepting help. All right. With that being said, I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.